Okay, so we got the next presenter, Dr. Rubaiyat Sharmeen, and she is going to present on the study to find out the role of low serum vitamin D3 as a risk factor in primary open-angle glaucoma.
Good morning, everyone. Today, the topic of my presentation is a study to find out the role of low serum vitamin D3 as a risk factor in primary open-angle glaucoma. I have no financial interest in the study. First, coming to the introduction, as we all know, glaucoma is a chronic progressive optic neuropathy and it's the most common cause of irreversible blindness in the whole world. So, early diagnosis and appropriate treatment is very important. However, intraocular pressure is one such important risk factor of glaucoma that can be modified. So, the research objective of our paper is to evaluate the association between serum vitamin D3 and glaucoma. Now, what is the role of vitamin D3 in primary open angle glaucoma? For that, we have to understand the pathogenesis of POAG, which is apoptosis in the trabecular meshwork, accumulation of extracellular matrix protein, and cytoskeletal disruption. This leads to increased oxygen-free radical in the aqueous humor, and this causes increased TGF-beta SMD3 pathway in the trabecular meshwork cells. And all this leads to increased extracellular matrix protein, fibrosis, and increased resistance in the aqueous flow, and this causes high IOP. Now here comes vitamin D3 to the rescue. Vitamin D3 acts on this step and blocks the whole process. So IOP is maintained. Now coming to the material and methods, this is an observational case control study. We have selected 50 patients of POAG as cases and 50 normal age and sex match individuals as control. The inclusion criteria is diagnosed cases of primary open angle glaucoma between the age 40 to 50 years, and we excluded patients more than 50 years of age, postmenopausal women, and the patients with metabolic and retinal disease which alter the vitamin D3 level. The study period is for 6 months and the study took place in AIOC Kolkata. Informed consents were taken, approved by the ethics committee. A detailed history taking and slit lamp examination is done for the cases and the control. We have measured IOP by Goldman applanation tonometer. We have done detailed fundus examination by 90D lens, the perimetry to check the visual field, and obviously gonioscopy to rule out angle closure. The serum vitamin D3 was measured by ELISA kit. Now coming to the results, collected data were analyzed using the principle of the descriptive statistics, and student t-tests were applied when required. This is the spread of the data according to age, sex, and religion wise, and we have found all the data has p-value 0.05, which is significant. This is the chart of the severity of the glaucoma, both cases and control in the both eyes, OD and OS, and which is also found out to be significant. And this is here we can see in this diagram that mean vitamin D3 level in the cases is much less than the controls, and this is also significant. Now coming to the discussion, there are a lot of studies happening around the world in this topic, and we have selected some, and all of this shows the inverse relationship between the glaucoma and the serum vitamin D3, and our study we have also found the same. Now to summarize, patients who have visual field loss, they try to restrict their daily outdoor activities, and so they get less sun exposures, and all this leads to vitamin D3 deficiency in these patients. As we all know, vitamin D3 is an excellent anti-inflammatory agent, and it also has neuroprotective effects. So in those patients, they are very much prone to optic nerve damage, and the further visual field loss in happening, and the vicious cycle continues. Now to conclude, lower serum vitamin D3 is significantly associated with risk of glaucoma. The take-home message from our study is additional vitamin D3 supplementation could prevent the progression of the optic neuropathy. There are obviously some limitations of our studies, which is small sample size, cataract were not taken into consideration, and vitamin D3 in aqueous humor is not measured. These are some of my references. Thank you.
Any questions from audience side?
Thank you. I have a question for you. So in your study, you said additional vitamin D supplement will help progression of optic neuropathy. Do you say that for established glaucoma, or do you say that everyone should have a normal vitamin D3 to prevent glaucoma developing?
We have, this is actually a observational study, not intervention. So we have an ongoing interventional study that is happening, and we are giving 40,000 international unit per week vitamin D3 doses to see the established glaucoma, so they can prevent the further IOP increasing. Not for prevention, for the established glaucoma.
Established glaucoma.
Huh.
Based on the severity of the glaucoma also, the vitamin D3 levels changed?
Yes, yes. The more severe the glaucoma, we have found there are less vitamin D3.
Did you measure this sun exposure, the hours of sun exposure in these patients?
No, they are mostly in the eastern zone population, so
The
no.
sun exposure is supposed to be good.
Supposed to be good.
You're right. So I live in UK and there is no sun there. So I'm just thinking why that may be one of the why the glaucoma is more common in this part. There's a lot of sun exposure. But anyway, thank you. Thank you
Okay.
very much.